Hello and welcome to Cornell Keynotes. My name is Sabine Jamal, and joining us in the studio today to discuss tick-borne disease prevention are Joellen Lampman, Tick and School IPM Coordinator here at Cornell's Integrated Pest Management Program, Emily Mader, Program Manager for the Northeast Regional Center for Excellence in Vector-Borne Diseases, and Amelia Greiner Safi, Professor of Social and Behavioral Science and Public Health at Cornell's University Department of Public and Ecosystem Health. As always, we will be taking questions from the audience, so please feel free to put them in the chat throughout. Joellen, Emily, Amelia, thank you so much for joining me today.
Thank you.
Thank you so much.
So, to get us started, could each of you briefly share how you work on tick-borne diseases and what part of the system you focus on most? Emily, I'll come to you first.
Absolutely. So I am a senior extension associate with the Cornell University Department of Entomology, and I'm also the program manager of the CDC-funded Northeast Vector-Borne Disease Center, where I've had the opportunity to work on many projects related to tick-borne diseases. But essentially, my work focuses on evaluation and then also supporting training programs for our public health infrastructure and workforce around tick-borne disease surveillance and response.
Thanks, Emily. Joellen?
Thank you. As an extension associate focusing on tick integrated pest management, my work mostly focuses on education with enough research to provide my audience and myself the confidence to be a trusted resource. I like to say that I get to study ecology where it matters to people's health. I get to study people to understand what they need to protect themselves, and I get to share what I learn.
Thanks, Joellen. And Amelia?
Thank you. Hi, everyone. So I'm Amelia. I'm a social and behavioral scientist, and what that means is I try to study what people do, why they do it, and as it relates to public health, how to make an impact. So my work is really impact focused, and I'd say I kind of study the whole system of tick-borne disease. So I think about the public and the different audiences there. So who are the people who have different information needs? What do they need? Why are they doing what they do? I think about the healthcare providers. What are their behaviors? Why are they doing what they need to do? How can they meet the needs of the public? I also think about local government and people who are doing outreach with the different community members. So how can I help them kind of best accomplish their goals, understand their audiences, understand human behavior, right? Because most of us never get training in that, or how to do strategic communication. And then the last piece is working with kind of researchers who are interested in understanding publics and vector-borne disease, so ticks, mosquitoes, everything, and how they can ask questions about behavior that are going to lead to like the most impactful interventions.
Great. Thank you, Amelia. So I'm really excited to have the chance to talk to our panelists about a whole gamut of areas focusing on tick-borne disease prevention. Joellen, I'd love to ask you a few questions first to kind of help set the stage for our audience. So what does the current landscape of tick-borne disease in the Northeast look like, and how has it changed in recent years?
So if you look at a map of tick-borne diseases in the United States, you will notice that there is the greatest density and diversity of tick-borne diseases right here in the Northeast. Lyme is going to lead that pack, but in New York alone, we are aware of 14 different human health impacts. That includes 7 bacterial diseases, 3 viruses, 1 parasitic infection, and 3 reactions just to tick spit. When I joined the IPM program in 2013, and I would go to visit Western New York, participants would often tell me that ticks were just not a problem. I wasn't even invited to go to places like the Adirondacks. Now I am doing presentations all over the state because of the health consequences that people are experiencing where they live.
Wow, so big changes. So it sounds like there are definitely changes in where ticks are. Are there also changes in when people are exposed or who is most at risk?
Yeah, I'm going to tackle the first two of the where and the when first. So tick biology really hasn't changed. What has changed is the types of ticks that we're finding in the Northeast. So many of us grew up with American dog ticks that are often found in tall grass areas. Black-legged ticks, or also known as deer ticks, they need high humidity, so mostly we're going to find them in or around woods. Lone stars are hardier, and they've even been found marching across concrete pavement. The newly arrived Gulf Coast tick likes tall grass areas. The Asian longhorn tick kind of likes it anywhere and everywhere. So there really is nowhere that is completely safe from ticks, including indoors if we have pets. And between all of these types of ticks, there's also no when that we are completely safe, with black-legged ticks being active even in the winter time. So between nowhere and no when, who's exposed is going to be mostly those that are going to be spending a lot of time outside. Kids, people with outdoor professions, and people with hobbies that also take them outdoors.
And how aware do you feel people are of tick-borne diseases and the prevention and control options that are available?
I would say it's still pretty low. And based on the reactions that I get from people when I'm doing my presentations, which is often shock surprise, there's a lot of room for awareness to grow.
Well, I'm very glad we're having this talk then with all three of you. So my final question for you for now, Joellen, is from your perspective, what's the topic that isn't getting the attention it should?
I am so thrilled to be part of this panel that's discussing and navigating risk. So often I hear people talking about the risk of chemical use, and that's their calculation. What is the impact that repellents might cause? Are they going to cause me harm? But a more thorough risk navigation is going to compare the risk of chemical use versus the risk of that tick bite and the exposure to these tick-borne diseases, and also include the disease treatment. What are the motivations for protecting yourself? I think I'm more motivated to not get bit by tick because I never want to be treated for Lyme disease again. That's a strong antibiotic. There's also that health risk of staying indoors to avoid ticks. Outdoor activity is vital to our physical, emotional, and mental well-being. So when we talk about risk, let's incorporate all of those into our decision-making.
Brilliant. I think that's a really great perspective we're going to be able to get from all of you. Emily, I'd love to provide our audience with some context on the public health infrastructure. So a lot of the work that happens behind the scenes, is happening behind the scenes in this field. Can you walk us through what public health infrastructure for tick-borne diseases actually looks like?
Yeah, absolutely. And I actually agree with Joelle, and I love that we're having this conversation because I think that there's a lot more players working on tick-borne diseases than people generally speaking are aware of. Because a lot of these groups overlap, I'm going to just generalize them into about 4 main categories of people working in the space of tick-borne disease. I'll start with the one I think most people are familiar with, which is monitoring human health and tracking human illnesses. And so this is often done by our state, local, and our federal public health departments. They work alongside medical providers to identify when humans and sometimes animals become ill with tick-borne diseases like Lyme disease, spotted fevers, or other ones. And this is really important work because it helps us understand how many people in our communities are becoming ill with these diseases. It helps us provide support to the medical community that are at the front lines of diagnosing patients when they become ill and treating them. And I think that that's generally speaking where most people identify tick-borne disease communication coming from. But there are other groups as well. The other one that I think maybe people have seen out in the public are the folks who are going out into the environment and collecting ticks. And so this is more of the tick surveillance and control side of the equation, a little bit more focused on the entomology of tick-borne diseases. And so both public agencies and even academic units of varying types, be it a health department, a public works department, Department of Agriculture, your local cooperative extension, folks will go out into the environment and gather ticks, identify them, test them for pathogens, and at times explore options to suppress the tick populations if they notice a problem. So this is a really important part of the equation of understanding what humans are becoming affected by ticks, but also what ticks are out there, what are they carrying, and where are people most at risk of coming into contact with them. The third group we have is the research community. which includes folks that work on things that are kind of chunked more into applied research. And what I mean by that is they're looking for ways we can improve our methods or answer important questions in a short time frame, so maybe 1 to 5 years. And some examples of that type of work might be, does mowing the tall grass near hiking trails at our local state park reduce the number of people who find a tick on themselves? Or does this pesticide product work better when we apply it in the fall versus the spring to keep tick populations in people's backyards low? So those are applied projects that a lot of research groups from public agencies and private agencies and academic groups are working on. And then there's the more basic science research side. So those are kind of the more long-term, a bit harder to answer questions like, can we develop an anti-tick vaccine? Or is tick saliva, what's that doing with the human immune system? And how can we work with that to maybe develop new therapies? So those are a lot of the research groups and the kind of questions they're pursuing. And then the last category, which I think spans all 3 of these groups, is community outreach and education. I think that many public, academic, and private agencies complete this work in varying capacities, but the ultimate goal is to increase awareness of our community members, the people who would be coming across ticks when they're doing their daily activities, let them be more aware of what's out there, understand the risks that they might be encountering when they have their daily walk, or if they're gardening in their backyard or going on a hiking trail, but also showing them what steps they can take to protect themselves from tick bites. So I think that holistically is kind of the infrastructure in public health, the primary actors working on the tick-borne disease problem that we're currently facing.
Thank you for that comprehensive review. So I'd be interested to hear what are the biggest challenges right now in capacity or that infrastructure you have described?
I think, in my opinion, one of the biggest challenges is actually the scope. There are several types of tick that Joellen mentioned. They live in many places and they spread many pathogens to people and animals. I think folks that live in the Northeast and the Midwest, and kind of increasingly moving south as well, it can seem like there are ticks just about everywhere that you want to be outside. And this poses a huge challenge to the teams charged with conducting tick surveillance and tick control. Depending on the jurisdiction, sometimes there's only one dedicated staff member available to conduct tick surveillance for an entire county, if anyone at all. So it's a huge investment of personnel time and materials. Then you add the layer of testing for pathogens, that itself is a complicated process and requires a lot of startup funding. The price tag of supporting a program large enough to give us a good picture of tick-borne disease risk in a given community, that's a real challenge. And many state and especially local agencies, they just don't have the infrastructure to support that robust tick surveillance program under the current structures.
And you mentioned funding. So how does funding, like state and federal investments, shape what's possible in this space?
I would say that funding is critical. Over the past several years, our group at the Northeast Center, we've reached out to our public agency partners and through surveys and working groups and roundtables, really trying to understand the barriers to adopting tick surveillance and control activities in their jurisdictions. And we consistently hear that funding is the key ingredient that is missing for programs to do more than they are currently able to do in this space. We've also seen that funding for tick surveillance control typically comes from and is largely provided through the federal government, mostly the CDC, the USDA, and a little bit the Department of Defense. And this support from the federal government through those mechanisms, it helps a lot. That is kind of pass-through funding that will go to state public health programs that run the labs that test ticks for pathogens and help support diagnostics for humans who might be suffering from tick-borne disease. And those funds also are what public agencies rely on to hire staff, implement new surveillance activities, new control strategies. It's really fundamental to supporting these programs that funding be in place.
And a slightly different question, but Amelia earlier mentioned about healthcare providers, and I was just wondering what kind of training healthcare providers need most when it comes to tick-borne diseases.
I mean, I think the fundamentals are pretty key there. So recognizing a patient's exposure risk, is my patient likely to have encountered a tick, and is that likely to be driving the symptoms they're experiencing? recognizing what those symptoms are, knowing what tests are appropriate to test for the different tick-borne illnesses that patient might be a candidate for having been infected with, and then also the treatment protocols. From what we understand, much of the training in those fundamentals for tick-borne disease diagnosis and management happens after a medical provider has left their primary training, whether it be medical school or the primary training program that they need to reach their practice credentials. This means that most medical providers who are working in primary care and emergency and acute care settings have to rely on continuing education opportunities to gain these skills. And we're in a bit of a mixed bag here. The good news is that there's many resources that currently exist to help them gain these skills for diagnosis and management of tick-borne illnesses. But the bad news is that they're not always reaching our medical provider audiences. Our team and others funded by the CDC are doing quite a bit of work in this space to better understand the learning needs of medical providers so that they have access to the training materials that they need, and they're provided with the information that will help them take care of their patients after a tick bite. So that's kind of like the baseline of where we need to really raise the bar in terms of access to medical community education on tick bite prevention and tick-borne disease management. I would say a secondary layer to that is that healthcare providers can and often do play a really important role in counseling their patients about tick bite prevention in their annual wellness checks or other kind of touch points they have with their patient population. So equipping healthcare providers with the updates on what tick-borne diseases are circulating in their areas, and having guides for them that help them have positive conversations with their patients around how to stay tick safe is also a pretty critical component of medical provider training in this area.
Thank you. And Joellen, so Emily just spoke about healthcare providers. I'd like to ask you about an individual. So if someone wants to protect themselves but still enjoy being outside, where should they start?
So there is a laundry list of strategies, most of which we've all heard many, many times, that include things like tucking your pants into your socks, wearing repellents, doing that daily tick check, throwing your clothes into the dryer. One that a lot of people haven't heard about is permethrin-treated clothing, which is actually treating the clothes with a pesticide that binds to the clothing, and then it kills the ticks that are getting onto the clothes. All of these are going to help, but none of them are going to work 100% of the time. So what I encourage people to do is to think of each of these strategies as a slice of Swiss cheese. So you got the cheese, it's got the holes in it. That's showing that all of these strategies are going to work in some ways and fail in other ways. So if we take one slice of Swiss cheese and we layer it with another, it's going to fail and work in different ways. So we're providing better coverage. So choose ones that work with your lifestyle, that you feel like you will do every day, and make them a habit so that they're going to just be incorporated into your life and help you moving forward.
So this kind of goes nicely into my next question. A lot of people might feel like advice is perhaps generic or a one size fits all. So how do you help people make decisions that fit their lifestyle?
I really feel like that Swiss cheese model helps to bring that home to people that, how do you live? What are you doing? Or even on a given day, what activity are you going to do that can drive how many strategies you wanted to put into place at any given time? I have some favorites. What are some things that you do every single day? One is you're going to get dressed. So if you have permethrin-treated clothing, then protecting yourself is as simple as putting your clothes on. Another habit that most of us have is brushing our teeth. So if at the end of the day we're brushing our teeth, let's tie the habit of doing a daily tick check to that, using not only our eyes, but our fingertips. And if we do this every day, we will know every skin tag, every freckle on our body, and it will take only a couple of minutes, which, by the way, is how long you're supposed to brush your teeth for. So I am in the mirror doing both at the same time, and it's very easy to make these things something that we do every day.
It sounds like you're talking about habit stacking, which I've heard is a great way of kind of getting new habits kind of ingrained and part of our routine as well.
Absolutely. And by having a list of things that we are encouraging people to do, and they can pick and choose from that, that's really empowering them to make decisions that are going to have the greatest impact on their lives.
Thank you. So, Amelia, I'd like to turn to you now to ask about kind of communication and behavior and how that ties in and wraps around everything Emily and Joellen have talked about so far. So, let's take a step back and think about you. You told us you take a systems view of people and behavior. So, what are the biggest factors that influence how people respond to tick risk?
Great question, Sabine. So I think about, so behavior is fun and complicated. There's 1,000 different things that all point kind of to the big five. And I think one of the first ones is people's experience and kind of social reality around ticks. So if you know people who get ticks on them all the time, if you get ticks on you all the time, if you've had Lyme, if someone close to you has had Lyme, especially if it's a more severe case, that really impacts your experience. This can also be if you see things on social media about Lyme, if there are people talking about it, if you're watching The Tonight Show and you see somebody discussing it, right? That's kind of part of your world that is going to influence your perception. The next big things are people's perception, and perception is a key word here. It's like, so what do people think their susceptibility is, and how bad do they think Lyme is? That may or may not map onto reality. So I think there are people who very rarely go outside, and their sense of risk might be somewhat outsized compared to their actual exposure. I think there are other people whose profession requires them to be outside all the time. I think some of those people have a pretty accurate sense of their risk, and other people, for whatever combinations of reasons, dismiss it. Then there's kind of how bad do you think Lyme is? If you don't think it's that big of a deal, that will impact your behavior in one way. If you think that in every single case, Lyme will always be awful, which is not the case. Most cases are not severe. Some can be. But your perception of how bad Lyme is going to drive your behavior. So that's kind of number two. The other thing is what people think about the solutions. And so by solutions, I mean both prevention and treatment. So I know Joellen talked about tucking your pants into your socks. When I talk about that with my students, they're mostly in their 20s, I get collective eye roll, right? Because the vision they have is of their grandfather and like big white socks in their pants, and like they don't want to do that. That's fine. I think there's other media you can use. Some people are big fans of repellent, other people aren't. Some people are really worried about wearing long clothing, even though some of that long clothing can actually protect you more from the sun and other things that bite you, like mosquitoes. So there's kind of, what do you think about this? Does it work for you or not? There's also people's thoughts about treatment. And so kind of the main form of treatment right now is antibiotics. Some people have no problem with using antibiotics as much as you need whenever. Other people really want to try to avoid it. So that will inform how you behave around ticks. I think the fourth thing is access to information. Information means many different things. It can be online. I think sometimes among the public health crowd, there's a thought that like, oh, well, if there's information up on our local health department website or with New York State IPM or with the CDC, whatever, that means it's automatically getting to people. And for a whole bunch of different reasons, it isn't, right? We're in this hyper polarized environment, and I'll probably get to this later in talking about trust and messengers. So whether this information is getting to people in a way that they can use and is relevant for them, that'll inform behavior. And the last thing is how all of these prevention strategies and Lyme disease aligns with people's values and priorities, right? If you really don't want to ever have to miss work, that's going to inform you one way versus others. If you really, really value being outside, that's going to impact your behavior in some way. So like those values, perceptions, access to information, and experience are all really important.
Thanks, Amelia. So, why is it so hard to translate guidance about tick prevention, like Joellen was talking about, into actual behavior?
Great question. Couple of answers there. So I think everyone every day is making 1,000 calculations about risk and benefit, right? So our brains are busy, our minds are full, and we're having to kind of add that decision making about tick prevention, tick bite prevention to that. There's a couple of other big reasons, though I was kind of mentioning before, the information doesn't necessarily get to people, or it gets to people, but it's not relevant. It's talking about kind of like, do you know how to identify a black-legged tick? And that's not really what people are interested in. They want to know, what can I do? What repellents are safe? What should I ask at the doctor? So information isn't relevant. Or it is relevant, but it's written in such a complicated way. It's this long wall of text, and that's just hard for people to follow. So one of the things that I do in my work is talk about literacy levels. And in the US, about 50% of the population reads at a 6th grade level or below. So I have like no broader comment on that other than like, our job is to make things useful to our audiences kind of wherever they are in terms of literacy. And I think the other thing that can be problematic is when the guidance insists on an approach that doesn't work for people. I think, as Joellen was saying, like, there's a bunch of different options. I think it's worth sharing what works best, which is, a combination, or do this, or make sure you do a tick check. But if you don't want to wear repellent, that's fine. Work on these other things, because I think you're going to lose people. So I think the more that people who are talking about ticks, who are talking about risk, can connect the story, can connect their topic with something that's relevant to their audience, the better success they'll have. The more they can do that in like a little story, actually, the better, because I think, I don't know, numbers and risk and quantitative calculations just don't stick with people. But if you're like, well, I knew somebody that like they really love being outdoors. They were not a big fan of repellents, but they were worried about Lyme because like their sister had a really bad case. And so this person ended up finding a repellent. It was approved by the EPA, but they also liked how it smelled. It was okay on their skin. And, they decided that this was ultimately the easiest thing for them to go outside and still not have to worry about it. Or, there's someone else I knew, and just repellents were a no-go, and that was fine. So we talked, and I gave them ideas on, here's some lightweight clothing that you can wear. It's going to keep you safe from the sun. You can go outside, do whatever you want to do. If you don't want to tuck your pants into your socks, fine. But just kind of advice like that, it's based in science, right? Those are legit recommendations, but they are connecting with what people care about. Because whether we think it's valid or not, people don't, there's things that they don't want to do. And if they don't want to do it, it's probably not going to happen. And the last thing I would say, so there's guidance that's given. I think expecting like an immediate reaction is not realistic. So behavior change is a slow burn. It's why relationships and having conversations over time and making it like an open and safe space for asking questions is important. So this is maybe especially important for healthcare providers out there, that there's a lot that's going on behind the scenes where people might start considering this before you actually start seeing their change in behavior. So I think it's really important to have clear guidance that's easy for people to read. If it's in a visual format, all the better, that it's getting to people and it connects to things they care about, like being outside, having fun, not needing to worry about their kids, not having to take time off work. And that can go a long way.
Thank you. And we've got our first few questions from the audience, so I'm going to ask them now, and I'll leave it to the panelists to decide, but I think maybe Emily, I'll pose the first one to you. We'll see if that was the right decision. So from Bob, thank you so much, Bob. We have a question that's made up of a couple of things. So Bob is curious about what's going on with the medical end of ticks. So asking about Lyme's testing, time tick is on, treatment courses, and when should someone go see a doctor?
Yeah, so I will do my best to tackle all of those, but remind me if I skip one. I think the easiest thing to answer is time of attachment. That will be a little bit different based on what tick is biting you and what it might be infected with. But the best thing anybody can do is, if they find a tick that is actually attached to them, pull it off immediately. The longer a tick is attached to you, the higher the chances are that it can pass something to you that will make you sick. And so that's just the number one thing that people can do, is take it off of you immediately. And then watch and wait, so there are some options on the table. If you meet certain criteria, you could maybe get an early dose of antibiotics to stave off a Lyme infection from kind of really taking hold. But there are some rules around that. It's not a fix-all that will work with all tick bites. And so the best thing that we would advise people to do is watch yourself. Are within the week to 3 weeks after that tick bite, are you feeling like you maybe are super tired? Have you had some fevers, aches and pains? Most tick-borne diseases do present with very similar symptoms. And if you're experiencing those symptoms after you've been outdoors, after you have perhaps seen a tick bite, those are things that you would want to take to your physician or your nurse practitioner, primary care, urgent care, a medical provider. Share that with them. Also be sure to let them know that, hey, I have been exposed to ticks, or I do activities that do make me have an increased risk of coming across ticks. Remind your medical providers that that's something relevant to you, so that can be part of your conversation with them when you're in the medical environment, to say, hey, I'm feeling these things. What do you think about running a panel for tick bite? So there's panels, there's one for Lyme, and there's one that has a suite of different tick-borne illnesses that they will run. They're usually done separately. But those are some really easy things that I think just about anybody can do to help monitor whether or not you should go see the doctor. I would recommend people to look up and become a little bit more familiar with how to safely remove a tick. Again, just harping on how important it is to pull off a tick once you do identify that one is attached to you. There are a lot of, wives' tales and kind of word of mouth recommendations of how to pull a tick off that include a bunch of different things that at the end of the day are probably going to irritate the tick, and you don't really want to irritate a tick that's attached to you. The best thing you can do is to just get some tweezers if you have them, or if you don't have access to tweezers, the CDC actually does now have guidance that you can use long fingernails, but you want to just basically grasp the tick close to your skin and pull straight out, no twisting, just pull it straight out. Those are things that you should be able to do before seeking medical care. I think a lot of people think that they need to go to urgent care to have the tick removed. This is something you can do in your own home. And so we definitely encourage folks to get a little bit more familiar with the process, so that if it does happen to you, it's not a shocker and you feel prepared to pull the tick off yourself. I think I probably haven't fully answered the question. So Sabine, let me know what I have skipped over.
No, I think that did fully answer the question. Joellen and Amelia, is there anything you'd like to add?
No,
One thing I would add to that is that if you do break off the mouth parts when removing the tick, it's no more dangerous than a splinter. So you don't need to go to urgent care to have it removed. You don't need to go to urgent care to have the mouth parts removed either.
Thank you. And a question has just come in that's very related, so I'm going to ask that one straight away. So thank you, Annette. So Annette is asking, what is considered a bite? Just a taste or an attached tick?
An attached tick. So ticks are different than, say, a mosquito. I think a lot of folks have had a mosquito bite where you'll see it land on you, stick out its little mouth part and like poke your skin a couple times. That's not how ticks behave. They will actually, sorry for anybody who's squeamish, they will burrow into your skin a little bit, and they will include something that we kind of refer to as cement, but their saliva will basically lock them in. So they'll be fully attached to you, and that's where they're going to stay until they're done feeding, which can be up to 7 days, depending on how old the tick is. And so it's tick attachment. They're not going to necessarily probe you and jump around different parts of your body the way mosquito might. Once they find a place where they want to dig in, so to speak, they will dig in and they will stay there. So if you find a tick attached, that's why you want to just grasp it close to the skin and pull straight out. It might take a little bit of time, but if you just give gentle pressure, the tick will eventually release and come off.
Thanks, Emily. So our next question is from Pat. Thank you, Pat. So Pat is wondering, when will the vaccine for humans be available? They say that dogs can get it. When can they? Amelia, I'm going to ask you that question.
Sure, I'll start. So there, for folks who don't know, there is a Lyme vaccine that's been in development for a little while. Pfizer and others just recently submitted this year, the data to the FDA. So that is in process. There is also a larger vaccine kind of advisory group at the federal level that needs to make a decision on what's going to happen there. That is in a bit of upheaval. So what I have heard is that kind of best case scenario is late 2026, early 2027. I don't have updated, I don't know if any of us know the next time the ACIP, the group that kind of makes these vaccine decisions, is going to meet. And I'm not sure if it's known when the review of this new Lyme disease vaccine is going to be on that meeting schedule. So it would be, I think, great news if this were something that was available to the public. People could decide whether that is something that they want to include in their kind of toolbox of options or not, but that's kind of the process. So the trials have been done. People can look up information on that. The data has been submitted to the FDA, and we're waiting on when kind of this federal panel will review it for their recommendation. And I know both Emily and Joellen have probably additional insight on this if you want to offer that.
Yes, absolutely. Joellen.
I have no additional insight on when. I will say that once it's out, I will be getting it. I'll be first in line. But I consider that if we can look at that Swiss cheese model, it's one slice of Swiss cheese that's going to help prevent Lyme, but not the other diseases and impacts that I was talking about.
Yeah, so that's a really good point. So the vaccine that's out there or that might become available would be available for kids 5 and older. You would need 3 doses over 6 months for it to kind of rev up and be fully active. And then you would need another dose every year to maintain that kind of that level of protection. The challenges, or I shouldn't say challenge, but one of the things to consider is that ticks can carry many different diseases at the same time. So you can have something called a co-infection, which means that you have Lyme and another one at the same time. So I believe with black-legged ticks, the big ones are babesiosis and anaplasmosis. So while that vaccine could help prevent the likelihood of you getting infected with Lyme from the tick, you could still get 1 or 2, or there's more of other diseases. So what that means, as Joellen was saying, is you still have to protect yourself from ticks, right? That it would be amazing if someday there's one vaccine that takes care of everything. I think that's pretty unlikely, but it still means that you'd still need to do a tick check or repellent or all of it, even if you do get the vaccine.
Thank you. Emily, anything to add here?
I think they both covered it perfectly. Yeah.
Great. And just a plug for a previous keynote, if we were interested in kind of how vaccine policy occurs, we did a keynote earlier this year on vaccines that you can watch the recording of, which would be linked to the things Amelia discussed. So we've got lots more questions from the audience, so thank you very much. Keep them coming. So Avara says they are curious about our panel members' thoughts on not testing ticks. So they have lived in Columbia County for over 13 years and had multiple tick-borne diseases and found that tick testing was an important strategy in their toolkit given the inaccuracy of Lyme's testing and that not all people have the same symptoms or signifiers of a Lyme disease infection. Avara says that I see it as an important data point to make decisions from, especially with many healthcare professionals not being Lyme literate. So, panelists, do we have an opinion on testing ticks?
So with the Cornell Integrated Pest Management Program, we follow the CDC recommendation to not have the tick tested. And that's multifold. One is if you have the tick come back and it was positive for Lyme disease, let's say, what do you do with that information? It takes time for that bacteria to enter the body and create an infection. So you might get treated unnecessarily because the tick was not attached long enough. The more compelling reason for me is that if the test comes back negative, but the tick you did not find had Lyme disease and you've gotten it, if you're not feeling well, I don't want you to take any of these tick-borne diseases off of the table. So that data point could cause you to look elsewhere when in fact you do have a tick-borne disease.
Thank you, Joellen. Emily, do you have anything to add?
I would just say that we also do lean on the CDC guidance, and I would second Joellen's comment there that I think our biggest word of caution is that you don't want to rely on the tick pathogen testing results as an indication of what actually might be happening with you, because you could miss an infection or you could stir up a lot of anxiety over a flat tick that wasn't attached to you long enough to make you sick, making you think that maybe you've been exposed to a really serious illness when in fact you are going to be okay. I will also say though that I think sometimes these, a lot of the programs that have people submit ticks and test them for pathogens, they can still be useful, not necessarily for a clinical diagnosis, but just as an awareness tool of, hey, ticks that are out in my environment where I'm recreating actually are infected with these things. And so even if the tick that I sent in wasn't attached to me long enough, or maybe, it is just one that I found crawling on my dog, so I wanted to send it in, that can be useful in just awareness building for both public health agencies and individuals who might be curious about what is circulating in the areas where they're recreating or spending time outside. And so I don't think that it was necessarily the strongest thing to lean on for a clinical diagnosis, but if you're curious, they can be great resources. And I don't think people should shy away from submitting ticks if they're interested in answering those kind of questions.
Can I add one comment, Sabine?
Yes, absolutely.
So we've talked around this a little bit, but one thing that I don't know if we've said explicitly, I guess two things, is that even if a tick is carrying Lyme, and that tick is on you, it is not a guarantee that you will get Lyme. So there's some mystery in that. There's research going into this. There's question marks right now around like how likely that is, but it is not a guarantee. So that's an important thing. I think the other thing to know is that kind of in the Northeast, about 50% of ticks carry Lyme. So just as people are thinking about evaluating their risk and whether this is something that they need to be thinking about or not, it's definitely something out there. It's in a lot of ticks. So I know I'm kind of saying two things at the same time, which is many ticks carry Lyme, but it is also kind of on this question of how useful is that data about a submitted tick. Just because a tick has Lyme and it's been on you does not mean that there's not a one-to-one relationship there.
Thank you, Amelia. I think that's some really important information. And I'm going to come to you again with our next question from Esha. So Esha is wondering, how would you approach members of the public coming to you with misinformation about ticks or tick-borne diseases?
Oh, this is fun. So, right, misinformation is hard, and it is pretty much a tsunami for public health. It is something that is really, really difficult to deal with, and I'm saying that to manage expectation. I think there are a couple of things you can do. I think it's trying to understand like the question or the fear behind the information. Like what is driving why a person is coming to you with this? The recommendation that I have heard and that I give to all of my students is that re-emphasize what is true. Sometimes what people do is myth busting. That's a mistake. What you want to do is highlight, well, this is what is known about Lyme. You're highlighting the true things, because the more you repeat the untrue thing, it gets messy in our brains, right? We can't remember which is the true one, which is the not true one, where we heard it from. So there is kind of this frequency relationship with the more you hear something, that's the thing that people recall. So I would try not to get in a fight online with people. Try to understand where the question is coming from. Sometimes explaining a process, it's like, well, let me show you, actually, let's walk through kind of how the transmission works. And not in I'm talking down to you, but as like a learning opportunity. I would also try not to get into a competition about who's right, and try to figure like whether this is actually like a battle going on behind the scenes and it's just about who's right. That's a very hard one to win, versus kind of a learning opportunity. There is, and I will see if I can find some resources on this to post on the page later. There are guides about how to handle misinformation out there. There's a researcher at Cornell. Her name's Claire Wardle. She's a professor in the Department of Communication. She's one of kind of the foremost researchers on how to deal with misinformation. So she would be great. So I will, I'll stop there, but I hope that gives you like a couple of footholds for dealing with this. And also, I think my heart goes out to anybody having to work with this because it's just really hard. And I don't want you to think that's like, oh, if they only did this one thing, then the problem would go away. It's really challenging.
Thank you, Amelia. Joellen or Emily, anything you'd like to add to that?
I really like what Amelia said about what's behind the question or the statements that are coming. And I've just stopped addressing basically the question and going straight to, okay, if that was true, then doesn't that make you even more motivated to not want to get bit by a tick? And let's talk about how we're not going to get bit by a tick. And just shifting the conversation, I found to be pretty successful.
And Emily?
Yeah, I mean, I think Amelia highlighted that this is a really challenging thing to talk about. I think often people are bringing a lot of emotions into it too, either it be fear or frustration or skepticism around recommendations that might be out there. And so I think just showing a little bit of listening skills, so just really trying to hear people and understand their perspective that they're bringing to the conversation. Just I think is really helpful when you're trying to talk about a difficult subject, whether it is misinformation or misunderstanding information that's out there and seeking clarity. Those conversations can often be charged. And so as much as you're able to just hear the other person, not interrupt them, just understand their perspective and where they're coming from, and then share the information that you know. Those often, in my experience, have led to really meaningful conversations where both of us learn new things. And that's, I think, a really good approach. It's not going to work at all times, but I think it can be a good starting place.
Thank you. So we have a question from Abigail, who works in a local health department, and says when their local health department does presentations on this topic to the public, they often get asked this question, and it's why individuals continue to have long-term symptoms related to Lyme even after treatment. Is that something any of you can speak to?
I can speak to it briefly, but I do want to caveat that I am not a trained medical specialist. And so there will be a limit to what I can share insights here, but I do work with folks who from the CDC as well as medical community who are part of research teams looking into this. There's no easy answer to why some people end up having these lingering symptoms after treatment, but we do understand that around 1 in 5 people might experience this, where up to 6 months after receiving successful treatment for their Lyme disease infection, they're still feeling it. Like they maybe have sore joints, maybe they're still tired, bit of a brain fog situation. And I think this is not unique to Lyme disease infection. We've seen this with other infectious diseases that after you are infected and you've had an immune response, something about you individually is resulting in this lingering symptom situation. And I think, unfortunately, the history of Lyme disease in this country has been a little bit, and I think probably in Europe a little bit too, a little bit fraught with people feeling that they weren't heard in a medical community when they received the treatment but were still feeling poorly. You can also get reinfected with Lyme disease, so it's not a one and done, which muddies the waters a little bit in terms of if people think that the treatment was successful. And so it is a little bit of a gray area. I will say that this is something that's being actively studied by multiple groups, both in Europe and in the United States, trying to understand what is it about individuals that predisposes them to having this lingering symptom situation around their Lyme disease infection and post-treatment. But unfortunately, right now, I don't think we have a solid answer as what the mosaic of characteristics are for individuals that predispose them to that.
Thank you, Emily. And we have another question from Bob and they are asking, what is the accuracy of the testing that is available?
That depends on which infection. And so I also will say, Amelia and Joellen, I'll jump in if you have additional thoughts here. But for things like anaplasmosis, babesiosis, viral infections, those are tested through detection of DNA, PCR, very accurate. And then for certain ones that are infecting red blood cells, like babesiosis, they can do blood smears, pretty accurate. And those are straightforward to diagnose if there's a really high confidence in that if you have a positive result, it's a true positive because they're detecting the pathogen itself in your body. Lyme disease is unfortunately a more complicated one because it relies on antibodies, which means that your body has to mount an immune response. It has to have mounted it for long enough that when you have your blood work done, those signals light up on the tests that are run. And if you're not in that window, you might miss an infection, or if your lab sets thresholds that are different than the standard threshold set by CDC or other health departments, you might get a false positive. So there's this risk of false positive and false negative, unfortunately, around the Lyme disease tests. That it does muddy the waters. It is an area that I think the medical community is growing in their awareness of those issues and how to surmount them. There is a lot more consistency in the way that public health laboratories and places like the Mayo Clinic set their thresholds of what actually is a true positive for a Lyme test. But it kind of depends on where your provider is sending those samples to be tested on what those thresholds are. That's why a lot of medical providers now will do follow-up testing. So if you think that you have been infected with Lyme and the first test comes back a little ambiguous, a little gray, it's not lighting up positive, they might wait a couple weeks, test you again. And after that period of time, your antibodies should be elevated enough that the test would light up and say, hey, you have it or you don't. So yeah, it's a challenge with Lyme, but the other ones are pretty solid testing.
Can I add one thing also? Sorry, Sabine, for constantly jumping in. So I think, again, thinking about kind of the ecosystem of Lyme, right? Like best case scenario, you're getting a provider who's really on top of things in terms of the potential for different tick-borne diseases. It might be for whatever combination of reasons, you're seeing someone who isn't as up to date on what's going on. So I think this is where being able to advocate for yourself is really important. So I think that's, in this case, it's two things. Knowing that follow-up testing might be important and asking for that if it's not offered, right? I don't want to encourage medical overuse. That's a problem too, and physicians and nurses deal with that. But it's also being able to ask about potential for co-infection. So if you've got some of these symptoms and people are only testing you for Lyme, it might be worth asking them to run tests for a couple of other things. If you're in a place where there's known to be more babesiosis, more anaplasmosis. So again, our goal is that we get to a point where like any provider you connect with is going to be completely up to date on everything that's going on, right? The medical world is complicated. They're dealing with a lot. The nature of vector-borne disease is changing. So kind of what you can do is try to arm yourself with high quality information. And I think that's kind of what this series like this are trying to do.
Thank you, Amelia. So we have about 5-6 minutes left, so I encourage our audience to send more questions. Whilst we are waiting for that, I would love to hear about how you might balance informing people about risk without discouraging them from spending time outdoors. Amelia, I'll come to you first, and then Joellen and Emily, I'd love to hear from you.
Absolutely. So I think general recommendation for any time you're telling somebody about something scary is you tell them what they can do about it, right? That's a recommendation that just holds for almost everything. So I think, so that's part one. If people are already super freaked out about Lyme, you're gonna wanna give more attention to all the things that you can do and the treatment options that are available. If people are not that scared about Lyme and maybe should be a little bit more, then you'll want to talk about like this actually in some cases can be really serious. So it's maybe worth considering these things, right? I know you want to be really active with your kids. I know it's really important for you to not miss work. Like connect it to something they care about, because sometimes for folks, staying healthy is not the thing that they care most about. That's fine. That's kind of a public health bias that should be the most important thing. I think also emphasize that two things can be true at the same time, right? That it is okay to be worried about ticks, or that, yes, this kind of stuff is changing. And for many people, the outdoors is this hugely meaningful thing. It's a way of escape, it's activity, it's mental health, all the things that Joellen was talking about. So, kind of matching your message to who your audience is, talking about that people have options. They can pick what works most for them. They don't have to do something they don't want to do. If they need something that's super quick, focus on the really quick things. That there's treatment options available, and like that the outdoors are worth it. So I think we can't completely manage other people's emotions, right? And like make them feel certain things. I think that gets tricky, but you can contextualize your advice and make space for both a little bit of worry and encouragement to have fun outdoors.
Thank you, Amelia. Joellen?
I'm going to agree with all of that. Research shows us that fear can be a motivator up to a certain point, and then it shuts people down and will have the actual opposite effect of what we're looking for. So when I'm giving presentations, I kind of divide it into, and I will let people know because I think humor really helps. So this is the scaring the pants off you part of my presentation. And it's to motivate them to want to do and I actually do a check, like, are you now motivated to learn how to prevent all of this? And they all say yes. And then I will pivot to the you shall overcome portion of the presentation. And actually, I start off with, they pay me to say this, avoid tick habitat. And then everybody laughs. And I use audience participation to talk about how we've already talked about there's no where and no when, that you're completely safe. So this is a piece of advice. There are choices we can make, like staying in the middle of trails, that will make it less risky, but there's so many reasons to be outside. So, and then I stress that, not going outside is not healthy for a variety of reasons. I also use my personal examples, my stories. One of my favorite hobbies on a yearly basis is going out into the middle of the woods and take pictures of spring wildflowers. So I'm in the woods on my stomach. So I'm pointing out, this is really tick risky, and I have not gotten bit doing this. Now we're going to get in to talk about how I don't. And people are really ready to listen at that point.
That personal connection must make it really engaging for your audience.
I try, and depending on the audience, I always try to pull examples and stories from my own life to say, hey, I'm like you, and we're connecting, and this works for me, and it could work for you as well.
Thank you. Emily, is there anything you'd like to add here?
I actually don't have anything to add. I think that we all follow very similar approaches to trying to help people feel that they can do something to stay safe and still enjoy the things they want to do outside.
Thank you. So I'm going to take our final minute to ask if that each of our panelists, and Emily, I'll start with you, if there's one thing you want people to remember when they leave the keynote today, what is it?
So I'm actually going to be the boring one, and I'm going to say that if you care about this issue and you want to support people who work on tick-borne disease studies, how to control them, how to help people feel empowered, feel free to reach out to the folks in charge of funding these programs to let them know how important they are to you. I emphasized earlier that funding is critical. There's actually a bill on I think the House side of our Congress right now called the Hagen Tick Act that is currently under consideration to be reauthorized, and that dedicates a large pot of money to CDC to then send to our state programs and our academic programs to work in this space. So if this is important to you, consider reaching out and letting people know.
Thank you, Emily. Amelia?
I would say don't dismiss people's fears. I think there's a lot of dismissal that's happened out there that really harms trust, and it harms the potential to build a relationship for having more productive conversations, go outside and do your tick checks.
And Joellen.
There are a number of options out there that will protect you from getting bit by a tick. So you can absolutely go outside and take full advantage of our absolutely beautiful part of the country.
Thank you. So that is all we have time for today. Thank you so much to our panelists for joining me to discuss such an important topic. And thank you to our audience for your thoughtful and engaging questions. We will see you in the fall for our next Public Health Keynote.